Hello friends, welcome back to my channel Medicine Hub on Zero One. Today we'll talk about diabetes mellitus, one of the most important topic regarding endocrinology and the GIT from aspects these things. Okay. So before starting, what do we mean by the diabetes? Diabetes means whenever we see the blood's glucose level that will be more than the normal level. So in these things we can see if you talk in terms of the type 1 as well as in type 2 diabetes, in both cases we'll get what the hyperglycemia. Okay. So I'll start saying in terms of the symptoms first. Okay, so let's talk about the symptoms, then we'll go subsequently in these parts. Now, whenever we're talking in terms of the diabetes mellitus, so what are the classical symptoms we'll get over here? So the classical symptoms, what we'll get over here. Now see, the first symptoms, let me write it over here. We'll get the polyuria. Second, we'll get polydipsia. Third, we'll get polyphagia. Fourth, we'll get the weight loss. These are the classical symptoms in terms of what the diabetes mellitus. Now we'll talk about each individual symptoms. Okay, now see. Whenever we are talking in terms of the polyuria means normally we know what the urine output around the normal 1.5 to around little write it over here, from 500 ml to 1.5 liter per day is the urine output. Okay, but it's the normal thing. Okay, but whatever the thing we'll see in terms of the polyuria, in polyuria we can consider whenever we'll see the urine output that will be more than 3 liter. Now why we'll see the more than 3 liter urine output? For this thing we talk a little bit of the physiology. And now see, for example, is the I'm just showing the nitrogen structures over here, the glomerulus part, and see whenever within the blood the sugar level is too much, as a result we will see the blood, along with the blood, the sugar, that much more amount of the glucose that will come over here. Okay, whenever there will be too much amount of the glucose over here, these cells, they will be not able to reabsorb all amount of the glucose. So there will be too many glucose molecules that will, okay, let me show over here. Anyway, so I'm just saying these things. So okay, let's write it over. Okay. Now we'll see along with the along with the urine we'll get the too much amount of the glucose molecule. Now we know that the glucose, they are having the chemo attracting property. They can attract the water molecules along with them. So along with them they will just opt for the chemoosmotic property. We'll see there will be what the urine output that will be more over here. So we'll get what the polyuria. Then the next thing we'll get the polydipsia. So whenever whenever the urine output will be more, as a result, what type of the thing we'll see, there will be what definitely the within the blood that will be what the blood that will be hyperosmolar. And whenever the blood will be hyperosmolar, within the hypothalamus there are certain types of osmoreceptors that will be activated, and whenever the osmoreceptors that will be activated, then whatever the thing that will activate the thirst center. Okay, so thirst center will be activated and the individual will start drinking water around more than 6 liter. In these cases we will see. Polyphagia means the person will feeling hungry over here. And third thing, here we will get the muscle loss stage in terms of the weight loss. Okay, that will be what the muscle wastage, or you can say the muscle dystrophy, just like this one. Okay, now these are the classical symptoms in terms of the diabetes mellitus. Now how can we understand the person is having diabetes or not? Before, whenever the symptoms, okay, just think about these things. Before 20 years or 30 years ago, whenever there was not such test based on the diabetes, at that time whenever the symptoms usually came, after that the persons used to know that is the person is having diabetes. After that we used to do what for the testing things? We used to do the first random blood sugar test. First, that was what the random blood sugar. Okay, and its amount whenever we got more than 200 mg. At that time, we used to just consider these things in terms of what, that the person is diabetic. Nowadays we do what, more type of the test. Basically we do FB as a fasting blood sugar level. Okay, during the fasting condition we can take the blood sample and we can measure the blood sugar level. Here if we get, that more than 126 as far as the American diabetes, center is concerned over here. So if we get more than 126 mg, okay, this much, then we can say the person is having the person is diabetic in terms of the fasting blood sugar. And 2 hours after having the meal, if we just see the blood sugar level is more than 200 milligram, you can see in terms of the percentage over here, if we get, then we can say the person is what, diabetic. Okay, now see, these are the tests, but what is the best test to diagnose the the diabetic persons, now diabetic individuals or diabetic patients? Now see, first you are doing, in this cases we have to do the fasting, then you have to do the what, that 2 hours after having the meal, you can just do the test. But many persons are there, they may be busy, so they may be busy in their work, so they may say, I don't have that much time, so I cannot come back again after 2 hours. So for that thing, we can do the best test for them, or overall the best test for diagnosis in terms of the diabetes mellitus. We can say what, that is the HbA1c, glycosylated hemoglobin. Glycosylated hemoglobin in these cases. Okay. Now, whenever we will see that the HbA1c, that will be more than 6.5% over here. In these cases, we can consider the person is what? The person is diabetic. The person is diabetic in terms of the HbA1c level. Now, let me show with this one. HbA1c, if we see it is less than 5.6%, then we can consider the individual is normal. There is no diabetes. The person is normal. Okay. Now, if we see in these cases, for example, if we get the HbA1c level in the range, for example, from 5.7 to 6.4, for example, in this way. So, in these cases, we can consider the patients, the individual over here, impaired glucose tolerance. So, you can consider this condition right now, impaired glucose tolerance, or I can write IGT. So, if you want to write it over here, we will write impaired glucose tolerance. Okay, in terms of the HbA1c level. So it will be the diabetic, it will be the impaired, glucose tolerance. In these cases, we will get the individual that will be normal over here. Whenever we will get the HbA1c level, that will be less than 5.6% over here. Okay. Now these are the tests in as far as So HbA1c, we can say, for example, if any individual who has eaten any food, for example, before the testing, so the individual who has done exercises, or individual who has not eaten for a long time. Okay, so if we just say in these cases, the HbA1c will be the best test. So by doing the testings in terms of the HbA1c, you can just diagnose that the person is having the diabetes or not. So we can just do HbA1c test. If the person's in fasting condition, we can do also. If we see the person is doing the exercise after that, the person has come to the OPD, we can do also. And if we see the person has, if we see the person has eaten something, but taken meal, after that we can also do the test for in terms of the HbA1c level over here. Okay, so that doesn't matter whether the person is doing the fasting, exercising, or he has taken the meal just before coming to the OPD. So that's not a matter over here. So we can continue to diagnose in terms of the HbA1c level over here to just confirm the patients or the individual who is having diabetes or not. Okay, now we'll talk about the other types of the test. Now see, HbA1c you can consider in this way, that in long term, sugar control, we can do this test in the long term sugar control. The individual who is having the diabetes for long term, and he's just doing the testings for HbA1c. We can just do in these cases. Now we'll talk about the for short term. For example, we want to know that whatever the test we can do in terms of the short term sugar control over here. So for these things, let me write it over here, and don't forget that HbA1c, that is the what investigation of choice. Investigation of choice. Okay. Now if you want to know in terms of the short term, okay, let me write it over here. Short term sugar control. That means, for example, individual is testing in terms of 2 to 3 weeks around. Okay. And here in terms of the HbA1c long term, so in terms of the HbA1c, it's around 3 to 4 months. 3 to 4 months. Okay. Now in this case, what type of test we can do? We can do the serum fructosamine. Serum fructosamine. Okay, in these cases we can do for short term. And one more thing we can also do over here. In case of the control of bronze diabetes, let me explain a little bit of this one. Bronze diabetes. Now, what do we mean by the control of the bronze diabetes? What is that bronze diabetes? Basically, if we see in terms of the children, in terms of children, if we see the children, those who are having the thalassemia, if you see the individual, they are having the thalassemia over here, and who is having the thalassemia in this case, definitely there will be what? There will be problem at the blood level. So definitely the hemoglobin that is not working. So as a result, we can see over here the amount of the HbA1 level that will be less definitely. So whenever the HbA1 will be less over here, definitely we are not supposed to do the HbA1c test, because whenever the HbA less, definitely it will be also less. Okay. So in this cases, what type of thing will get, whenever in terms of the thalassemia, we need to do the blood transfusions. Okay. So in these cases, we will see when you are just transferring the blood again and again, as a result, we will see the deposition of the ferric over here. So whenever these depositions will be too much, that will go where? Within the liver, and that will cause the liver cirrhosis. As a result, we will see there will be problem as per the skin is concerned, like the bronch corridor, just like this one. So as a result, we can see the word bronch diabetes. Okay. In these cases, also we can do for the diabetic things to confirm the diabetes. Okay, we can do the serum fructosamine. So as far as the short-term sugar control is concerned, you can do the serum fructosamine. As far as the control of the bronch diabetes is concerned, you can also do the serum fructosamine over here. And in these cases, we'll get the melanin that will be activated, and that will just alter the skin color over here. Okay. So this was all about the testings. Whatever the test we can do in the different aspects. Okay. Now we'll talk about the complications. We'll talk about now the complications. Okay. Now let's write down about the complications. So these are the classical symptoms. I have already said you guys. Whatever the complications we'll get in these cases. Okay. So the main complications I am writing it over here in terms of the diabetes. I'll explain today the complication in terms of the microcirculation. Okay, let me write it with another one. Let me use the black one. So whenever somebody is having the diabetes mellitus, we can just see the problem as far as the microvascular is concerned and macrovascular is concerned. Whatever the problem we'll see in terms of the microvascular concerns over here. Okay, so first thing we'll get, this individual is having the diabetic retinopathy. So whatever the problem we'll see in these cases, there will be chances for having a blindness. Chances is having for blindness. For example, for the normal individual is having chances for the blindness, but the diabetic person is having the chances for blindness for the diabetes 25 times than the normal people or normal populations. Okay, that will cause the diabetic retinopathy. Now, how the diabetic retinopathy, we can see over here, that will just do the destructions of the, for example, is the blood vessels. Okay, now see, and when we see that, we know that in terms of the diabetic conditions, we know there is a sugar, that means the glucose will be too much. So within the circulations, these glucose molecules, they will react with the plasma proteins. So glucose plus proteins, with that they will do a reactions. There will be the glycosylation of the protein, and that can destroy the. In there are further mechanisms. I'll talk about these things in the pathology aspects. So that can cause the destructions of the the vessels of the retina, that can cause the blindness over here. Then we can get over here in terms of the diabetic, retinopathy done. Then we will get what? Diabetic neuropathy. Diabetic neuropathy. In these cases, almost in example over here, in terms of the diabetic neuropathy, whatever the thing we'll see, the sensory system, the sensation, that will not work properly. As a result, we'll see there is a chances, in terms of these things, if the diabetic persons, those if they develop, that means, if I am repeating once again, if the diabetic persons, they develop the myocardial infarctions, for example over here, if they develop the myocardial infarctions, but that will be painless. That will be painless. So you can say the silent myocardial infarctions over here. Okay, and why silent? Why it will be the painless? Because the sensations, because of what, the diabetic neuropathy, the nerves, they are not working properly, the sensations are not coming properly. As a result, we will see in these cases that painless myocardial infarctions. So in these cases, we will see the sudden cardiac death. Sudden cardiac death. So this is all about the diabetic neuropathy. Now we'll get the third one, diabetic nephropathy. So in terms of the diabetic nephropathy over here, in these cases we will see that will lead to the chronic kidney disease. The diabetic nephropathy that leads to formation of the chronic kidney disease. In these cases we will see, try to understand, in these cases we will need to do the what? The kidney transplant. In these cases we need to do the kidney transplant over here. Okay. Now we'll talk about what type of the problem we will see in terms of as far as the macrocirculation is concerned. Let me use this one over here. Okay. Now we can reduce. What is the chance? What is the way to reduce all these type of symptoms as far as the the microvascular problem are concerned? If an individual, they can just restrict, they can just maintain the HbA1c level normal. If they try to maintain this type of the normal, that means the strict, we can write it over here, strict HbA1c normalizations, for example, then these chances are the chances for developing this type of the symptom, this type of the disease or problem, that will be less. Now as far as the macrovascular is concerned, whatever the problem we will see over here, let's write the name of them. Macrovascular is concerned, whatever the problem we will see in this level. Now as far as the macrovascular is concerned, whatever the we will get in these cases, we will get the peripheral arterial disease. Peripheral arterial disease, in these cases we will get, that will produce the gangrene. That will cause the gangrene, where in the dorsal part of the foot. In these cases we can get, the peripheral arterial disease over here. And what about another thing we can get, also the coronary artery disease? In these cases there is also chances for developing around 5 times more than the normal individual we can get in these cases. So this type of the problem we'll get. There are many problems, I'm not talking in details all of them. So we'll get the peripheral arterial disease, we'll get the coronary artery disease. Now we'll talk about a little bit about the insulins. Because in this level we know that whenever we are talking in terms of the diabetes, we know that definitely there is what insulin shortage or the insulin production is good, but the receptors, okay, the receptors of the insulin that are not activated, they are not working. That means the receptors of the insulin that functionless in these cases. So for example, when insulin will work stop, that means whenever we will see the blood sugar level that will be less than 70, at that time we will see the insulin will stop working. Insulin will stop working in these cases. So whenever insulin stop working in these cases, whatever the problem we will see, that will develop the hypoglycemia definitely. So we'll see the what hypoglycemia, and whenever we will see this type of thing, insulin stops working, we will see in these cases that some counter regulatory hormones will be activated. What are the hormones over here? The counter regulated, definitely we know the glucagon, we know the growth hormones, you know, we know these hormones that will be activated. And you know, whenever growth hormone, if growth hormone activates too much, it can, you know, it can just leads to the formation of what? Acromegaly. In this case, we also see the activations of ACTH that will leads to the Cushing syndrome. Cushing syndrome in these cases. Now we'll talk about a little bit part of the things over here. Now see, if I just say it's the normal beta cells, okay. Now here the GLUT2, you know, the GLUT2, that means glucose linked, okay. Let me write it over clearly. GLUT2. GLUT2 receptor is present over here. It is always monitoring the blood sugar level within the cells and outside the cell, within the beta cells and outside the beta cells. And whenever during the feeding conditions, we know that the glucose that will come within the cells, as a result, we know there is a, you know, in physiology I have already said, a video you can just take over there, insulin synthesis and secretion. Here we know by the active, you know, by blocking the ATP sensitive potassium channel, okay, by blocking the ATP sensitive potassium channel, we will see the insulin that will come out. And with the insulin, we will see there will be some productions of the C peptide, and we will also see production of some amylin. Now, what is the function of the amylin? That will control the mobility of the food within the stomach. So that will, for example, this amylin that will go within the stomach and it will control the mobility. That means, try to understand from here, it will, for example, okay, how much food is needed to reabsorb, that much food, amount of the food that will only come over here, okay. And for example, after that, whenever it will be reabsorbed, after that the rest of the food that will come over here again and it will be reabsorbed again, and it will go to the through the portal circulation, through the portal circulation it will go to the livers, just like these things. The function for the amylin over here, we need to know in terms of these things. It will go to the stomach and it will control the mobility of the stomach, as if more amount of the food there that not to be able to come within the, you know, where within the intestine to get reabsorbed, to get absorbed from here, and by the portal circulation we know this food will go to the liver, okay. So this was all about in terms of, you know, that how the insulin is coming. Actually, whenever we will get the insulin within the beta cell, that will be in the inactive form in terms of the pre-pro-insulin, that is known as pre-pro-insulin. After that, whenever it will come out, it will be known as what? Insulin, that will be in active form, that can work over here, okay. And see, we'll get what? The amylin, we got over here the C peptide and the insulin. Now, whatever the problem as far as the classification of the diabetes is concerned, we'll get in terms of the two types of the diabetes. Okay, I'll talk about these things in details in the subsequent part. So, as far as the types of the diabetes is concerned, we'll get over here, for example, type 1 and type 2. I'm not writing type over here. Now, in terms of the type 1, whatever thing we'll get over here, in terms of the type 1 diabetes, we'll get, there will be destructions of beta cell, when we can consider this, when can you consider that the person is having the type 1 diabetes? When you will see 80% of the beta cells already got destroyed over here. In these cases, you can consider the person is having the type 1 diabetes, and the type 1 diabetes that primarily seen in terms of the children. So primarily we can see in terms of the children. In the old age you can also see, that's not like this thing. The primarily in terms of the children. And what, okay, let me show over here. And what are the etiologies that can cause over here? We'll get in these cases autoantibodies, because we know that it's autoimmune disorder. So we'll get the autoantibodies against HLA, DQ, DR3, DR4. Against these antigens, you will get the autoantibodies. As a result, we can see this type of the thing. And you can also see there are some of the viruses like the Coxsackie virus. Coxsackie virus that can cause also the type 1 diabetes. That can also cause damage of pancreatic beta cells over here. And you can remember a little bit of it. Okay. So if you want to remember, you can remember in terms of the rubella virus in okay, you can remember in this way, or if you want to remember. Then the leftover moms, yes, I forgot to mention this one. We'll get the moms over here. Okay, now about the treatments and about the management of this diabetes mellitus we'll talk about in the subsequent part of the video. So if you think that this video is helpful for you, please do like and subscribe my channels, and don't forget to share among your friends, as if they can also be helpful for these things. Thanks for watching. See you in the next video soon.